Hello, viewers. My name is Juan Rajeda, and I will be presenting genital herpes for my Health 101 class. So, what is genital herpes? According to the Center for Disease Control and Prevention website, cdc.gov, they state that genital herpes is an STD caused by two types of viruses. The viruses are called herpes simplex type 1, which is abbreviated HSV-1, and herpes simplex virus type 2, which is abbreviated HSV-2. So how are herpes spread? Herpes are spread, according to the CDC, that through all types of sexual intercourse, oral, anal, and vaginal. They also state that herpes can also be contracted by contact with a herpes sore or lesion, so a herpes blister, and saliva from a person with oral herpes, and genital secretions from someone with genital herpes. They also state that even if someone is not visibly affected but still has the virus, you can still be affected. So what are the symptoms of herpes? WebMD.com states that the symptoms of herpes are itchiness or tingling in your genital region. They state that itchiness is usually, quote, followed by painful small blisters that pop and leave sores that ooze or bleed, end quote. According to WebMD.com, people who are infected with herpes begin to feel symptoms within at least 3 weeks of contraction of the virus. They also state that other common symptoms are flu-like symptoms such as headaches or fever. Yet, WebMD states that, and I quote, some people have few or no symptoms. So how do we prevent herpes? Prevention of herpes and all STIs are paramount. One can use the most effective form of STI protection, which is the male condom. Also, for sexual partners that do not need to utilize condoms, it is important to regularly test oneself in order to be predisposed to safe sex. WebMD states that it is best to take the following steps of avoidance of spreading herpes during the prodromal phase, which is tingling symptoms during recurring outbreaks, and the active phase, which is blister outbreaks during the primary infection of herpes. The following steps are: do not share towels and personal care items whether you are infected or with someone that is infected. If you touch an infected area, wash your hands thoroughly with soap and water. And last of all, avoid all sexual contact whether you believe somebody has herpes or you know that you have herpes. So here are some important facts about herpes. According to medlineplus.gov, the virus stays in your body for life. I also quote that repeat outbreaks are common, but over time you get them less often and the symptoms become milder. They also state that the virus is immensely harmful to those with weaker immune systems, such as babies or children. This is meaning that in the event that a mother has genital herpes and she begins to go into labor and she's going to have a newborn baby, she may actually pass genital herpes onto the baby through the childbirth process. WebMD and MedlinePlus.gov both state that some people have some or no symptoms, so that makes the virus harder to detect and making regular testing efficient and preventive from spreading herpes. So the last but most important thing about herpes, what do you do when you get it? First, when somebody suspects that they have an STI or STD, they should schedule an appointment with their healthcare provider. Then, when meeting with their health professional, explain all symptoms that you have. Don't hold anything back. After explaining the symptoms and talking with your health professional and finally getting diagnosed with herpes, they'll begin to explain to you that there are different kinds of treatments for herpes. The most common medical treatment when you initially get herpes is called the antiviral therapy medication, which will usually be a medication that you administer between 7 to 10 days. After the initial treatment, one will either be prescribed intermittent treatment or suppressive treatment. Intermittent treatment is prescribed to be taken for a couple of days during outbreaks. But on the other hand, suppressive treatment is for outbreaks that occur often. Therefore, suppressive medication is usually taken daily. After your initial treatment, it is best to contact anybody who has been your sexual partner for at least the past month. Also, if you have active herpes, refrain from any kind of intercourse or physical showings of affection to your partners. Once you have gained control of the infection, it is best to practice safe sex and let any future partners know of your infection. Although it may seem as if that will cause an insecurity, others who may have experienced or have herpes may be more open and accepting of your condition, especially as a sexual partner. Also, anybody who are you in a healthy relationship with and knows that you have herpes will most likely treat you with respect and embrace your condition. Lastly, before this video is over, anybody who has herpes should know it's okay. There's nothing to worry about because there's between 10 and 60% of people on this planet that have herpes, so it's not as uncommon as you think. Also, nowadays, if you practice safe sex and you test yourself regularly, it's actually a good thing. And especially if you're looking for a partner in a relationship, they will respect and accept the fact that you take good care of yourself no matter if you have the infection or not. Finally, before I end the video, I just want to credit my information that I got for this presentation was from the CDC, which is the Center for Disease Control and Prevention, also from webmd.com and medlineplus.gov. Thank you for listening to my informational presentation, and bye-bye.